morning, everyone. I'm Dr. Salvatore. I'm a provider. If you've been following along on our social media, this is an ongoing segment in our month of May, Mental Health Awareness Month. I'm here today just to talk a little bit more about mental health in general, what is positive mental health, what is negative mental health, and also hopefully easing the stigma a little bit of getting help and also just understanding what mental health is. So far this month, we've covered depression, we've covered anxiety. I believe this week we're going over PTSD, and then the last week of the month we'll be covering substance abuse. Hoping this will be a little more of a collaborative question and answer type session. I will be monitoring the chat, and so will our team. So I'll be happy to answer any questions that anyone has. Why don't we get started talking a little bit about mental health in general? Well, most people are familiar with physical health, how your body is working. When you get sick, you go see the doctor. You take medication if you need to. You undergo special treatments if you have a more severe sickness or diagnosis. A lot of these are transient. They come and go. Like the flu or the cold. And some are a little more intense, some are chronic and ongoing throughout the life. Others are acute, so they come on very fast and very strong, but they're pretty short-lived. Mental health can be similar, and we like to break mental health up into a few different categories. So there's affect or emotion, there's cognition or your thought patterns, and your mental processes, what we might also call executive functioning. And then you have your somatic and behavioral components. And this is kind of where there's an intersection between mental health and medical or physical health, what the field is moving towards calling behavioral health. So this would be things like what you do that involves both your body and your mind. Things like sleeping, sex drive, appetite, being around people. All those kinds of things are mixed together. So what does positive or healthy mental psychological functioning look like? A lot of that depends on the environment, the context, the culture in which you were raised in or which you're currently in. But for the most part, we like to kind of define it as being able to do what you need to do where you need to do it. So functioning or performing adequately in your home, with your family, in the workplace, at school, at church, in the community, with other people that you know, with people that you don't know, functioning in healthy, normal ways. Sometimes that starts to get a little bit different, and what you'll hear me say a lot is these things look differently for different people. But again, we'll kind of go back to that baseline of being mentally healthy is being able to do what you need to do where you need to do it. This starts to change in one of two ways, and this is where someone like a diagnostician, a clinician, a psychologist will come in and diagnose or say that we need to treat something. And that's when either one of two things happens. One, we are not functioning or doing the things that we need to do where we need to do them. Maybe we're having problems at work. We're not able to get there on time. We're not able to perform our job tasks. Maybe we're not getting along with coworkers. At home, that can look like different things. Sorry, everyone. My service dog Waffles is here, and he does not really want to leave. At school, this could look like not completing assignments, not being able to interact with your professors or other students appropriately. Maybe you're missing class, or you're coming in late, you're leaving early. At home, this is going to look wildly different to different people. So maybe if you have a romantic partner, maybe you're not able to talk to them the way that you need to do. Maybe you're not able to interact with them in positive ways most of the time. If you're a parent, Maybe you're having a hard time being around your kids. You could be more irritable with them. Um, you could just not be interested in what's going on. And a lot of times, even if you are able to do all the things that you need to do in the places that you need to do them, the other place where we would come in and say, all right, maybe our mental health is not in the best place, is if you're able to do all those things, but you're just kind of miserable doing it. So let's break down in each of those ways affect or emotion, cognition and thought process, and then somatic behavioral. So with your emotions, emotions are a positive thing. All emotions are good and they're here for a reason. So sadness is telling us that something is important and that we need to honor and respect that feeling and kind of analyze what's going on around us. Anxiety or fear is very, very important because it's telling us that something is dangerous and that we need to change something around us or change something within us or do something to change the situation because something bad could happen. Anger and frustration can also be positive things because they can give us that energy and momentum to change our feeling state from sadness or anxiety back to something positive. So even though we may view those emotions as negative, they're not necessarily negative. They don't feel good. The problem comes when you are feeling one of those things more or most of the time, and maybe the environment doesn't match that. So maybe we're getting angry when that would typically, something in the environment happens that would typically just be mildly annoying or irritating, but we're getting very, very angry. Maybe nothing bad or scary is happening, but we just feel sad anyway, or we feel anxious, we feel scared, maybe even panic, but nothing is going on around us. And this will also change our thought process, which is the next step. So your thought process encompasses a lot of things. So, and a lot of those things are what we say differentiates us from most animals, at least that we're aware of. So these are things like being able to focus attention and concentration, remembering things, language, planning and making decisions, judgment, morality. All of those kinds of things are our thought process. And when those things are working well, we're able to do what we need to do, where and when we need to do it. When they're not working well, then that starts to get affected. So if you see people becoming increasingly forgetful, especially with small things, that could be a sign that something is going on. If we're having a hard time focusing attention, a lot of times this may look like needing to read the same page in a book over and over and over again before you're really grasping it. Those things are telling us that maybe something is going on. And there are some mental illnesses and diagnoses that are mostly cognitive rather than affecting the mood or our physiological rhythms, which is the next part. So this is our behavioral and somatic piece. And I talked a little bit about it before, but again, it's that intersection between medical and mental health that constitutes behavioral health. So in behavioral health, these are, again, affecting things that we do. Appetite, using substances, sex drive, sleep is a big one. So that could be sleeping all the time or having trouble sleeping. Trouble sleeping could look like having a hard time going to sleep, waking up often, or waking up too early and not being able to fall back asleep. And that could be caused for a variety of different reasons. So why do all of these things come about? This is a very good question, and there's a few different schools of thought about it, but most people can agree that there is a genetic component. So some of these things are hereditary. If you have people in your family who are more depressed or more anxious or have a hard time focusing concentration on things, that is something that could very likely be passed on to you genetically. The other side of this is our environment. And for some of us, even if we have a very, very heavy family history of certain mental illnesses, If our environment doesn't really elicit those kind of responses, we may not develop anything. So it's really a mix of the two. So what are you predisposed to experience as far as mental health or being mentally unhealthy? And then what does your environment, your childhood, your adolescence, your adult life, the things that you experience and that happen around you, how are those going to affect you? And what responses are they going to bring out? So just the last part of mental health that I'll get into before I want to open it up more to the chat room and any questions. And I apologize, I haven't been taking a look at this. All right, doesn't look like there's anything there. So the last part here would be, speaking more about how these things um, how these things happen and what they may look like. So you have your major mood disorders, and these are things that are going to affect those feeling states. Major depression, generalized anxiety, bipolar disorder. Some of them are more serious than others. Some of them come about um, quickly. Some of them come about during a certain developmental age. But again, it's going to look like different things to different people. And it's also normal to experience symptoms of these different disorders during different periods of your life. And sometimes this is going to be a pretty normal experience. Most adults are going to experience some kind of mental health symptom over the course of their lifetime. That's just a pretty normal thing, just like an otherwise healthy person may get a cold if they're in the right environment. So maybe they're around other people who are sick, or they're not getting enough sleep, or the weather outside is cold and they're spending a lot of time outside, or it could be a combination of all those things. Now, a lot of times people don't really want to talk about these kinds of things because, one, they're very, very personal. We may not want to talk about what we're feeling, what we're thinking, and even if it may be apparent to other people that we're having those somatic and behavioral symptoms, they can be kind of hard to come to terms with what you're experiencing and to talk about it. Often, again, different to different people, but often this can be because we view mental health as a shortcoming within us. So if we're feeling too sad or too scared, or we're getting too angry, or we're not sleeping enough, um, we're not able to think straight. These things can sometimes be seen as either all our fault, which is one very hard thing to deal with, or it can seem the opposite, as if it's all the environment's fault. And if it's kind of an all or nothing thing, that's very, very difficult to address. Culture also plays a large part in this. So if too much emotion is expressed, or too many of these things that we're experiencing and talking about to other people that are not normal, so we're not functioning the way that we should in different parts of our life, we're probably going to be getting a negative reaction from those other people there at work, at school, at church, community, especially at home. And so getting those negative experiences is going to reinforce those thoughts of either, well, this is all my fault and that's bad, or this is all everyone else's fault and that's bad too. Either way, it doesn't get us in a good headspace to really address what's going on. And when I talk about culture, and specifically with our military population, military has a very hard job. And if you are physically ill or sick or not working the way that you're supposed to, that's going to be very difficult because you have certain PT standards and everything that you need to meet. That's physical fitness, and physical health is very, very important. Mental health is also very important because there's going to be very high stress, high pressure environments and situations, and you need to be able to not just do what you need to do, you need to function above and beyond. You need to be able to do more than the average person in that situation, just like your body needs to be able to function more than the average person in any kind of situation. Now, a lot of veterans that I've spoken to don't really get even physical health issues addressed while they're in. It's more like if something is going on, you don't really want to fall out of formation or during your PT runs or rucks or whatever. But you may go up to like a corpsman or a medic after and kind of something vague like, my feet are really hurting, or Maybe I'm having a little bit of trouble sleeping, and they're going to give you, maybe some kind of short-term medication to address those issues. But often those things don't go away quickly, or maybe even at all, and we need that kind of ongoing treatment. So same thing with mental health. Even just basic military training, let alone A school, C school, tech school, AIT, um, and different specialized schools, they can be very, very almost traumatic or very different than what most people experience. And especially on deployments or remote duty stations, hardship deployments, we're experiencing things that most humans, most civilians have no idea about, and they're never going to experience. So putting that strain not just on our physical body, but on our minds, our feelings, our thoughts, our behavioral patterns, all that stuff can take a toll. Now, why may we not seek mental health? Again, there's all those reasons that we talked about before that can apply to civilians. But in the military, we may not want to seek help because we're afraid of losing our clearance, afraid of losing our job, afraid of being ostracized, maybe not losing rank, but not being able to make rank and advance in the future. And all those things are very important, because it's often a kind of a warrior culture. And so not only can your body take it, but your mind can take all of that and more. And showing weakness is a way, whether that's in your body or your mind, that's a way that's going to get you cut. And failure is not really an option. However, when we are not addressing things as they develop, it's just like with most kinds of physical health. Some things that we can fight off pretty easily without medical attention. Some things you definitely need to see somebody, and they're not going to go away. And actually, if you ignore them, not only are you going to get more sick, but you can also maybe not ever return to that prior level of functioning in your body before, and death can occur. Mental health may not always be as drastic as death, but there are some things you're going to be able to handle on your own, those adjustments and adaptations. And for a lot of us, there's going to be some things that we can't handle on our own. And as if we are able to get them while they're developing, while they're first starting out, they're going to be a lot easier to treat. So it's like maybe you're starting to get the flu, you're getting a little sick, you go in right away, urgent care or to your primary care physician. They give you some antibiotics. Maybe you don't feel great for a week or two, and then you're back in it. Everything's fine. Sometimes, with mental health issues, they can be as cut and dry as that. Um, Sometimes, again, they are not, and you may need to, depending on your presentation and what's going on with you, maybe that's talking to somebody, maybe it's being involved in a group, maybe it's medication, maybe it's just increasing those natural supports in your life, a family, friends, self-care activities like your hobbies and interests, things that are going to be able to recharge you and get you back doing what you need to do where you need to do it, and hopefully not as miserable as it may have been before. You definitely have options while you're serving, but there are also a lot of options in the civilian world as well for all of these things. And there are many more treatment options than even I've just spoken of now, and that are being discussed over social media. Uh, but as far as overall mental health, it's pretty similar to physical health, where you may be very healthy and nothing may be going on, but probably it's a good idea to still go in for that annual physical. And as you get older, you're going to have those other kinds of things that you may need to do. For men, prostate exam. For women, a mammogram, colonoscopies, things like that. Those are just things that we need to do as we get older. Mental health can be viewed similarly. Maybe everything's going fine, but for people who have been in therapy and taken medication for a while and then things resolve, it's pretty common for them to check back maybe once every few months, once a year, once every few years. And it's healthy for people who are overall generally healthy psychologically to do the same thing. A lot of times we can do that with those natural supports with our friends, family, and community, but it never hurts to talk to a professional as well. And as we continue to address these things, and you're probably seeing a lot of other things on social media right now for Mental Health Awareness Month, this is just part of the human condition. So your body is incredibly important. Your brain is very important too. So we need to address health concerns with each because they're just going to come up for everybody. And that's not really something that we can escape. If we try to hide and escape from it, chances are things are going to get worse in a way that may not be repairable for us, and it's certainly going to have an effect on the people around us. But that's about all I have, but I'm happy to address any questions in the chat room. Let me check that again. If I'm already service connected for mental health, can I still do a Telemedica evaluation? Yeah, absolutely. So talking about service connected benefits for our veterans, if you're already service connected for a mental health condition, there are several reasons why you may need to do an evaluation with us. So you may have received a diagnosis and service connection when you were if you were out processing or possibly getting med boarded. Uh, if that's happening, a lot of times, especially coming out of active duty, it can be really hard to talk about those things. And you may be seeing somebody, and you're just trying to get all your stuff done. You're just trying to get out. So maybe not everything that you're experiencing came up. So if you feel like the rating that you got, the diagnosis was either incorrect or that your percentage didn't really reflect everything that's going on, you may want to come in for one of those. Now, also, besides an increased claim, the VA also often does reviews where they're basically trying to see, do you still meet criteria for the mental health condition you were previously service connected for? And since that last rating, has it gotten better, stayed the same, or gotten worse? So in those situations, you may want to come in for an evaluation for more support and more evidence to show either you do meet criteria, it stayed the same, or it's gotten worse. If you're interested in keeping your percentage and current rating, and which really is just designed to ensure that you and your family are taken care of and that you always have those resources for the treatment that you need, and hopefully they get resolved one day. The last example of when you may want to come in for another evaluation, even if you're already service connected, is if the VA is bypassing the review process and they're just wanting to sever benefits or sever your mental health connection. That does happen sometimes, and it can come very suddenly and be very scary for a veteran and their family. So in cases like that, you can make an appeal or you can put in a new claim. And in those cases, what you're wanting to do is, again, get that more support from us. You're going to want to get a professional medical opinion from somebody that's saying, whoa, 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 stop. We do still meet criteria for this diagnosis. This mental health condition is still going on. And we don't, not only is it still here, but this is our level of severity. So we don't want those benefits to go away. Is the evaluation like a therapy session? No. There are some aspects that are similar. So when you're first meeting with a therapist, they're probably going to do what's called an intake session. And you may do that with just someone at the mental health clinic where you're receiving treatment. That's kind of their intake person. Or it may be the therapist that you're going to be seeing long term. This is not really like that. This is usually a one and done kind of thing. So while it's still important for us to generate some rapport and have a good connection, it's going to be a very brief encounter. And we're not looking at any therapeutic aspects. It's more of like a fact-finding mission for us. And depending on if it's an initial review claim, we're really looking, and this is what I tell veterans when I'm meeting with them, we're really looking to answer a few questions for the VA. We want to know, do you have any mental health conditions? Were they caused by your time in service? And then if so, how bad is it? So we're not really trying to have anybody relive anything negative or traumatic. And those things, those very sensitive things, should usually be reserved for your individual or group therapist. We're really just looking for an understanding of what life has been like for you before, during, and after your service. And we'll be paying special attention to all those mental health components that I spoke of before. So affect, emotion, cognition, thought process, and somatic behavioral patterns. Does Telemedica offer therapy? At present, we do not. However, that is something that is in the works, and we're hoping to be able to offer telehealth therapy sessions and group sessions in the near future. How do you determine if it's just a bad day, week, or if you're having an actual mental health issue? So for that's a great question. Typically, we have diagnostic criteria for each of the different mental health illnesses. We use what's called the DSM-5, which is basically like our Bible. It's our kind of our playbook of everything that has been decided currently has good clinical utility, or kind of casts a wide net and captures a lot of these mental health experiences. Most of the time, these diagnoses have some kind of time frame. And it's not going to be a few days or weeks, it's going to be months or years of these things happening. Typically, for most of the mental health conditions in that DSM-5, you're going to be seeing a pattern of these mental health issues in one way or another for at least 6 months, if not 1 to 2 years. So bad day, week, usually that is going to be environmental. So maybe there's a lot of stress at work, maybe there's a lot of stress at home, and so you're having a bad day or you're having a bad week. With mental health conditions, we typically see them when there's something larger going on, they're occurring somewhat independently of the environment. So maybe there's not a lot of stress at home or work, but you're still feeling depressed, you're feeling numb, you're feeling flat, you're more irritable, and there's not really any reason for it. And again, this is going on over a period of months and maybe years, and other people are going to notice. How do I tell my family and friends what I'm experiencing? How can I be honest about my mental health issues? That's a great question, and can be kind of difficult to not only answer, but to address. Typically, this asks for a great deal of emotional vulnerability and honesty. And of course, there's going to be that fear of how people will react. I think one of the best ways that you can go about this is by kind of assessing who you can kind of trust the most, or who you feel like will either be accepting of what you're speaking about, or will be able to help you on the in the next step. And it's also kind of thinking about, what do you want from that conversation? So are you just wanting to, come out and say, this is what I'm experiencing? Are you looking for more support from them? Are you looking for help? Are you looking for things to change around you? So kind of setting the framework and expectation there is a good way to start. So, hey, I just wanted to talk to you about some things I'm experiencing. I don't necessarily need help from you. I'm just kind of wanting to explain what's going on for me. Or it may be something where you are looking for something specific. Hey, I'm having a really hard time in this way, and something that may be helpful is if you or the family or what have you, if we can start doing this. Probably you are not going to be the first one to notice some of these things. Often the people around you can notice and know that something is going on just as quickly. But there's also a lot of really great resources online, because this is a very broad question and very individual as well. There's some really great websites. There are military and veteran specific resources that you can look up. Another good one is psychologytoday.com, which offers ways to find and search for providers in the civilian world, as well as just general tips and guidelines and advice on how to handle some of these issues. But going into it, when you want to start speaking about some of these things, uh, know that it's going to be difficult. It's going to be difficult for you. It may be difficult for them, and it's good to kind of have a framework and expectation going in, and also some ideas in your head for what you can do after, whether it goes well or it goes poorly. What can you do after to make sure that you're okay? How are you going to get that self care or do the things that are important to you and kind of give you that life and that energy back? Will I have any repercussions for informing my employer of my mental health status? You should not. Unfortunately, this is not always how it happens in the military or the civilian world, but you should not. There are legal protections in place, and some people can get accommodations for mental health concerns. I would say it does help before you inform your employer to have some kind of professional that you're working with also have support for you, whether that's they release medical records to you or they're writing a letter of support on your behalf. Then you have some more strength and power going into that conversation, which could be pretty difficult. There are some professions where this is a very sensitive topic. So for people in commercial transport who have CDLs, pilots especially, people who work in law enforcement or public health, protection, defense contractors, this is going to be a big issue. However, even if you have a diagnosis of mental health and you're experiencing some of these really difficult things, as long as you can show that you're getting the treatment that you need and your symptoms are managed, for the most part, you should be protected. Again, there are some very specific professions, especially those needing certain kinds of clearances, that are more difficult, but those should also have guidelines. These are the things that you can do if you're experiencing mental health conditions, and these are the things that you can't do. They may have certain medication lists or other requirements. So it would probably be wise to inquire about those first before informing your employer that anything else is going on with you. Now let's see if we have any others in the chat box or sorry, I'm not exactly sure what happened there. I hope everyone can still hear me. Looked like we had a chat come up, but I don't know exactly what happened. Okay, well, we'll wait a couple minutes and see if there's any other chats or questions that come up. Um, I hope that this was helpful. Again, this is a very broad topic and one that people are starting to speak up about more. A lot of celebrities coming forward, a lot of other veterans coming forward, people from all different walks of life speaking about their experiences, which is good and also indicative of this stuff can and does happen to everyone. And it's not a sign of weakness or that something is wrong with you or that you're weird. These things come up for a variety of different reasons. And it could partially be genetic, it could partially be your environment. It's often a mix of both. And what is most important is addressing those as quickly and as soon as possible so that you can ensure the best possible life for you going forward and for your family and those that you care about. Because many of these conditions are very treatable. There's been a lot of research going on, even in the last 5, 10 years. So we know much more about mental health conditions, and how to treat them through different kinds of traditional therapy, through medication, and other options, which you can find out more about online, either through VA resources or through websites like psychologytoday.com that are more geared towards the civilian. And there's no reason why your life going forward should have to be how it may have been in the past, because there's a lot of different options. And this isn't a promise that everything will maybe go back to normal or how things might have been before, but they can almost always get better. And that first step is really hard to take, but it is an important one. I hope everyone is enjoying the Mental Health Awareness Month social media that we've been doing. And please speak up, support your family, support your loved ones, support other people experiencing mental health struggles, and remember to take care of yourself. Thanks, everyone.